Hi, my name is Dr. Andrea Ellis here at Meadows Chiropractic, and today I just wanted to talk to you about rib subluxations or misalignments. Now, the reason why I'm creating this video is because this is something that I used to see really infrequently, more so in my pregnant patients, usually because relaxin was letting joints move a little easier, a little more freer, and they would wake up with rib subluxations or misalignments, pretty common. But the last 2 years, I've definitely seen, and I've probably seen more rib misalignments in the last 2 years than I've seen in the last 15 years of my career. So whether that's increased stress, whether that is just long-term bad workstation ergonomics, maybe working longer periods, I'm not quite sure. So what does a rib misalignment look like, or subluxation? Typically when I have somebody coming in, they're going to tell me they woke up in excruciating pain. Sometimes, but not all the time, having pulled a muscle in their upper back the day before. So whether that was a workout, whether that was gardening, doing extra work, and just feeling a tight spasm muscle in the upper back the day before, and then waking up the next morning with sharp shooting pain that wraps around the ribs. Classic rib subluxation pain pattern. Number two, they're going to tell me it hurts to take a deep breath in. The ribs, when we breathe in and breathe out, we expand and contract, and those muscles don't want to do that if we're out of alignment. They get really angry, and that's what's creating that sharp shooting pain. So the not being able to take a deep breath in is one of the symptoms. And last but not least is not being able to turn your head. So for me, it's been every time. It's always on the same side as the subluxation. Whether that's true for everyone, I don't know, but if someone can't turn their head to the right, typically they're gonna have a right rib misalignment, and then to the left is gonna be a left rib misalignment. So that's typically what a rib subluxation feels like. How do we treat that? We adjust it. We either use our hands, we can use a drop table, we can use an activator. And then what that can look like for patients as we get that adjusted, sometimes we only get a little bit of relief. We just take that edge off, or that sharpness off, which is really a good relief because that's usually the worst of it. But the muscles around those ribs have to calm down, and it can take a day or two for those to completely calm down. And some people feel immediate relief, like it's just gone. So that is what a subluxation in the ribs feels like, and what we do to fix those. So should you ever wake up in the morning and feel like you're having a heart attack, you're having pain that's wrapping around, it's hard to breathe, you think it might be a heart attack, please go get checked out by your medical professional, because that is a concern these days. But once you are cleared, if they're just telling you it's a muscle spasm and they're giving you the anti-inflammatory and the muscle relaxer, let your next stop be to a chiropractor and get that rib adjusted. You're going to get a lot faster relief with that. So that's all I got. You guys have a great evening. See you soon.